Hi everyone. I cannot believe this is my final discussion post for BayPath. It's been a really great journey. So, if I were to imagine that I was on a job interview and had to explain the project that we've been working on in this class, I would have to say that it was a self-directed learning project that was actually encouraged and inspired by this class. But it's been something that I've been wanting to work on for a really long time, and I finally had the opportunity and the know-how with the help of the guidance of my professor and my technical advisor. But I didn't really have to imagine this all that deeply because I'm I've been at the hospital for a year now, but the position that I'm in, I started in the lab and now I am what is called a family support provider, and I think I've mentioned it in one of my other videos. I basically work with teen moms and really young parents. Most of them are under the 19 and under. I have like one or two 20-year-olds, but anyway. When I originally started this position about little little under 3.5 months, I had already been kind of talking about this project, and because I knew this class was coming, I didn't know exactly what was coming, but I didn't know exactly what it entailed, but I knew it was gonna um, need a project that I would be working on, kind of like a social change cause and something that I felt strongly about. So I'd already been speaking with a lot of people in the different behavioral health department about um, pornography, it's the effects that they see on some of their clients. So I actually have two bosses. So the director of my program, she has a dual purpose. So she's the director of our program, but she's also a clinician in the psychiatric inpatient unit at the hospital. And then my other boss is my supervisor is a clinical supervisor, and she's a licensed social worker. But the clinician in the hospital, who's the director of the program, had asked me if I'd be interested in doing this training, which I've taken the class at the hospital, but she asked if I might be interested in learning how to teach the class. This class helps hospital staff see sexual abuse in some of their patients. Also helps them notice the signs of sex trafficking or any other things closely related to that, and the steps to do if you do recognize those signs or you see those signs. So now that they've been listening to my project and they've been hearing me speak about just sexual problems, sexual addiction, and they've seen the work that I've done on this project, they were really kind of pushed and asked if I could become a facilitator of that class. So I'd be the person that trains the hospital and the medical staff on those issues. Apparently, the person that we have now is contracted into the hospital, but they would like a hospital staff member to be trained on that, and that's what I will be doing. So in March, I will actually be going down to South Carolina to learn how to become a facilitator of this program, learn how to train people, and teach that class. I'm really excited about the possibility of this. This is pretty amazing. The other neat thing is they did offer me more money. So I'll still be doing my family support position, but the other job doesn't it's not a full-time position because it basically is only during orientation, or if there's other employees that somehow missed it, it'd be that. So I'm designated 4 hours a week in addition to my other hours that I'll be doing, and it's a little bit more money. So I'm really excited, and not just about the money, but just the idea of being able to help in an area that I really feel like I feel strongly about, and just really amazed that I'm already seeing signs in my career. And I'm just, if you asked me 5 years ago, I wouldn't even have known I'd have gone back for my bachelor's. I definitely would not have been considered going to grad school, which I'm probably going to be applying this summer. Not probably, I will be applying this summer, especially since both the director and my clinical supervisor are really kind of pushing me. They think that I would definitely be good at a clinical level. So I'm really amazed that I'm already like making connections. And honestly, BayPath and this class has really helped me put myself out there and take the steps in the networking and just really asking people how they got things done. And I actually met a woman tonight that started a nonprofit, a little bit different. It's for like suicide prevention, but I just feel like I'm constantly making connections. And Baypath and all these well courses really, really helped me, just give me the confidence to be able to go out and ask people things that I wouldn't normally. So I'm really excited about my future. I'm really happy with the job that I'm doing now. I'm really happy with the prospect of thinking of where my project is going to go. And I've just been totally amazed by all of you wonderful ladies. And I wish you best of luck in all of your endeavors. And I believe that we all have been empowered. We've all learned to be leaders to this class. And I think we all have a message of hope. And I think that hope is like a really important thing to be able to pass on. So um, keep being your awesomeness. Best wishes.